Hey guys, I'm back from the video. So this is the dentist answers again. So another video. Today we're going to go over what we keep in the practice for medical emergencies. So recently we did our CPR training, and we did CPR training with a company called, I'm going to show you what the company's called actually. So this is Resuscitation Consultancy Medical Services, specialists in emergency life support training, the expert solution, professional choice. So these are the details of the place. So this is a video for general people who want to have a look, see what we do for medical emergencies, what we have, and also it's good for other dentists and practices that may or may not have one of these. This kit is superb. My boss got this a while ago. It is an excellent piece of kit. The person who put this together is a genius, because this is everything you need for any medical emergencies, and there's a guide for each type of problem. So it comes in this kind of bag. It's a medical emergencies grab bag, so just grab the bag, got everything in there that you need. So a few things. Got the side pouch here. I'm gonna open that. And in here, come on, got a side patch in here. You will keep these in. So this is the main thing. We've laminated it, print it off, and this is the thing. It's like an aid memoir. So you just follow this. This for every time medical emergency. Anyone is unwell in your practice, you'd get one of these first. You follow it, and then you've got for each type of problem, you've got a different guide. So that's chest pain. We've got hyperglycemia, which is when you have low blood sugar. It can affect people who are feeling not had much to eat, or diabetics. Mainly diabetics it can affect. Then you've got stroke. For stroke, what with the information there, and asthma. Asthma is very common. Lots of people have asthma, but it can be medical emergency. It's just that it's so common. Can we say not dangerous to have asthma and have a severe asthma attack? So asthma. Sepsis, deadly. Yep, so you've got to be aware of sepsis. And convulsions, so fitting. Somebody suffers from epilepsy. Epileptic seizures. And then finally, anaphylaxis with allergic reaction, severe allergic reaction. You're allergic to penicillin, things like penicillin or something like that, or any kind of thing you may have an allergic reaction to. You may have had. So with us, commonly, one of the things you have to be careful about is chlorhexidine, which is Corsadil mouthwash. So some people have an allergic reaction to it. So that's the stuff you do. So you'd basically go for this plan. If someone's feeling unwell, go through this crib sheet. You'd go through these stages if it's a medical emergency, and we do CPR training as well. So we did it recently, and they went through all this. And the lady actually did CPR training. Said, when I said to her, because she works for the same company, I said, this is brilliant. She actually mentioned I've been to a place where they had everything in a carrier bag, which when you're having a medical emergency and you're panicking, you're stressed, because it's not something common. You need something to make it easy and quick. So this is the bag. You get the bag. We normally have all of these like this, in this order. That's on the front, that's all that, all laminated, all easy to get hold of. And we will put it in here, in this part here, to grab it quickly. So that's the front part. That goes there. Yeah, so zip that up. If you then open the next bit, we've got every single thing you could possibly need here. This is to sucking up if you're not near the dental chair, because suction, just to sucking up blood and vomit and stuff out of the mouth. Anything stuck in the mouth, you can suck it. It's like a pump action. Yeah, pump action system. I'm not sure how effective it is, but it's better than the thing. You can also lean the patient to one side and let any vomit and thing drain out. So that's that thing there. Then we've got other stuff like a bag valve mask. This is like this one is CPR, so this is just put over the mouth. I don't really want to get it out, it's not ideal to get it out, but you've got this can be connected to oxygen, and then you kind of put it over the mouth of the patient and you squeeze it when you do chest compression CPR. when someone's stopped the breathing, they're having a cardiac arrest. Then you put it over the mouth. Just small one for a child, but you've got other ones there as well. Small mask, and you can just do that, and you've got oxygen flow as well. So that's quite good. So that would go in there. So you just tie that there. So that goes in that area there, which is again brilliant. You get all you need to, and then here's all the other stuff. There's a larger one. We've got a large one. The brilliant thing is with this, you don't even have to go, because that small one's a child, large one's an adult, you don't even have to swap the mask when you've got already there. So that's attached to each of those things, so that would go in there. So it says here, manual resuscitator. Yep, manual, there you go. So we've got that there. And that one there, this is just, I want people to know that this is just what we do, how we have things all set up properly. Then you've got these ones that a lot of the time people wouldn't really use, we wouldn't use, because of, it's like, these are airways, so you put it down. But a lot of times they don't show up, you don't use them really, that's more for like advanced life support, so we do basic life support. Okay, so you've got all the different sizes, something we have to have. I'm not sure you'd use it in a medical emergency, because as long as you keep the airway open by tilting the head back, head tilt, chin lift, and keep the tongue down. Because when someone is stopped breathing, one of the things when they pass out, the tongue flops back and blocks the airway. So you have to get them unblocked. So as long as you keep it tilted like that, it's fine. That's going to go in there. And then you've got, this can be used, these are like, adult, McGill forceps. These are like using for fishing something out if you want something stuck at the back of the throat. Big long things there, so that goes there. So everything basically has a place, and everything's easy to get hold of. Right, so that's that stuff there. So that's the outer part bit. Okay, so we know all the stuff's in there. So you always get, from time to time, we're not busy, we just get ourselves familiarised with it all, and we do check it on a regular basis to make sure everything's in date, because things expire. I don't, maybe it still worked, it probably wouldn't. So you have to, anything that expires, you have to replace it. Whether it's masked or whether it's like anything, you replace it. So the main thing is this. This is the real genius stuff. Now, this is what explain. Every single area has something important. So this is a mask for someone who you just want to give them oxygen. So they put it over their mouth. And you just connect it to the oxygen tank. This is just for a breathing mask, you know, just when they're feeling a bit, they need some oxygen. We have oxygen in here, and that's checked as well, so I'll show you where that is in a bit, because it's right hidden down here. So, but we'll go through these first. So we've got this bit here, which is just like blood pressure monitor, check the blood pressure. You can buy these, pretty good blood pressure monitor. So that's in one part of the pouch. That goes there. And then we've got, for every single issue that could occur in your dental practice, or this is all the things we have. So we have, I think that should be maybe, I think, a bit better like this. You can see if I just flip it around right. So this will be upside down. So when you open it up like that, you can see. So, bleeding. Hemorrhage control, bleeding, basically you've got, you know, bandages and things like that for any bleeding issues, so you can wrap it. And there's loads in there, absolutely loads, more than you probably ever need. Again, better too much and not enough. Convulsions. This is, and look, the great thing is what you do is all color coded. So again, this is the genius of this system, and this is what I advise any practitioner that have it. I'd highly recommend getting it. Remember I showed you these? Look, first one we're going to go through, convulsions. So let's go to convulsions. Look, black, black, black. Okay, convulsions. We go through all the stages, one by one. Firstly this, and then you think, oh, there's issue of epilepsy or fit. Then you know exactly what to do. You go to this. We get trained in this anyway, so you can't just, you know, you either, I won't say follow an idiot's guide, but you can just go for it all. And then convulsions, we've got, this is, again, genius. Seizure lasts longer than 5 minutes. call 999. If not, already called. All the information there. But genius, absolute genius. You don't have to remember anything, just there. And this is if you have to give this drug, which is something that will help with epilepsy, midazolam. So that's one thing. Good thing. Everything's in date. We always check it regular. So that goes back in there. If you have to use it, we're taught how to use it. That goes there. Asthma. Right way round. Asthma here. Asthma. Idiot's guide again. Take 1 puff salbutamol inhaler every 30 to 60 seconds, up to a maximum of 10 puffs with a spacer device. So obviously if they're struggling to breathe, you don't want to make it any difficult for them. All they're going to do is 2 types, child one, adult one. Perfect. Yeah, spacer. What you do, got the inhaler already, not in the packet, give it a shake, put that on the end in there. Squeeze. I'm not going to squeeze because I don't want to waste it. And then they breathe through the mouth this end. Okay, so it saves. Put that back on. Back on there. That's all in date because you check it. And it's got you exactly how to use it, but you know how to use it. Pretty straightforward. All the instructions there. That's in there. That's in there. Genius. Absolute genius. So put that back in there. Keep that safe. These are checked regular by staff. These I think they check every couple of weeks, make sure we put a date on when things are expired so we can order in time. Chest pain. So first thing, chest pain. We know what to do, chest pain. Chest pain, again. So we did, asthma. Again, green for asthma, okay? And you go through all the 5 stages. It's got a flow chart, easy peasy. Chest pain, let's find chest pain. Chest pain yellow, or the stage what to do, chest pain. So chest pain, don't have a heart attack. If they're having an angina attack, now angina, they normally have a this GTNR spray, this spray that people have angina know about it. Spray it under the tongue. We've got dosage just under the tongue, and pretty straightforward, and dispersible aspirin because I think they have to chew. Yeah, but again, you go again, follow the instructions, follow the flow chart. And what you will do at any stage where they say you will just phone for an ambulance. If in doubt, we just phone for an ambulance. So that's that one there. Hypoglycemia, diabetics. Again, for this one, you have, let me drop this. Glucose monitors, checker glucose, yeah. So you've got little tabs. These are little tabs of test strips. You've got a little needle, side of the finger. It's painful. Put it on the test strip. Check it. And guess what? Oh, I'm not sure how much when we should do it. Well, look at that. That's normal blood sugar level, 4 to 7 millimoles per litre. If it's 3 or less, glucose. If they've got this stuff called glucogel, the box is a bit squished, but it doesn't matter. Glucogel, just squeeze it inside of the cheek, inside the cheek, and that'll get the blood sugar up. And just keep that. Just check it again if you need to. Fast acting. That's what you want. Fast acting. If they're unconscious, you can use this one. This is really good. Again, we've taught how to use it. It's easy stuff. Once you know, once you've been taught, once you've got all the instruction thing. And again, here we go. Genius. Stage you go through. You don't have to remember anything. It's good to know some things, but we do know the things. But when you're stressed and panicking, because you will be stressed and panicked because it's not something we're used to, then you will be able to follow this. You'll have one person following that, one person delegating in control, and the other people doing whatever they need to do. Okay, so that goes in there. Again, this is all beautiful. Idiot's guide, which is just what you want when you're panicking. And the other thing is, it sticks. It's got Velcro. Each one that stays in place, doesn't move around, just stays in one place. So then hypoglycemia, and finally anaphylaxis. Orange. Genius. So again, it tells you exactly how much you're meant to give. of this, which is for anaphylaxis. It's adrenaline. Yeah, adrenaline, and you give the right amount for the right age patient, over 12 years, adult, 6 to 12, 6 months to 6 years, under 6 months. This way you do it. God forbid you don't want to have to do any of this, but it's all there. You've got it. So, as well as that, I've got another pouch there, not needed, but another pouch down there. So that goes into Velcro again, stuck on there. What we've got on the side here, we've got a side bit here, and this, look at this genius again. What's in there? Let's have a look what's in here. Open this up, and we have a pulse oximeter. And I can do this, let me just have a look. Switch it on. There we go, put it on your finger. If you can't put it on your finger, you can put it on other part like the ear and the nose and stuff. So look, there we go. Saturation levels, there. Bit high, man, bit high. Basic. 84, that's a bit high, isn't it? That's not really good. Going down, no, it's going up. Okay, anyway, I'm not resting. There you go. Brilliant. Again, we can turn it off. The battery run out. I assume that will just go off on its own. Batteries in there. Yeah. So, just going to take that off just in case. Right, it's off now. Don't let me run it out. So that's there, but then next to that, so it's got a little pouch in there. Can you believe it? Look, for the pulse oximeter, and this little bit to stop it walking off. And then we've got the big thing. This is the oxygen. You give oxygen via this thing. This got it already attached. I better be careful with this. I definitely want to turn it on. I'll move this all out the way now, and that slides in there. Oxygen cylinder with the mask. Yeah, absolute genius. It's all connected. You're just gonna make sure you open it from here, and then you whack it up to 15, most cases 10 to 15 liters per minute, and it's good. It obviously, if you ever have to use it, God forbid, again, you ever have to use it, or we don't want to use it, just like having something there, but we don't want to ever have to use it. You know, it's at max. There you go, maximum. You can see that. That slides in there, all connected, so you don't start fiddling connecting when you're panicking. There is a little bit here somewhere. So let's just have a look. So that's going back in there again. Again, in the side, right in there, all buried underneath and protected. That's a pulse oximeter, the same place where you need it. And that is for tells you for COPD what it should be and everything. That's fine. Now there's something else here. What is that in there? What is that in there? That's a bit tight, isn't it? Or is it just? Am I just looking at that? 1 second. Oh no, that's okay. That's okay. Just a side thing. I'm not sure why that's there anyway. So that's that, and one of the most important things you're going to need, one of the most important things, well, oxygen is really important, all these things are really important. One of the most important things you need is this. And like, okay, I just want to quickly show you one more thing with this. It's all padded as well, so it won't get damaged. You can carry it like a rucksack, or you can carry the handle there, or you can carry it handles there. It is a bit heavy because of the oxygen, but it's not too bad. So I've only got this at home because I had to take it home from when we did a CPR training, which we have to do every once a year, at least once a year. And I do it online as well, so separate stuff online. But this is when you have to actually have the mannequin and practice CPR and practice medical emergency. They give you scenarios, you have to do well enough for you to pass, and we did do well enough. We don't normally do well enough, it's not rocket science, it is stuff. So as long as you're smart, you don't panic, and you just make sure you've got plenty of help, and you've got something, a plan in position, in place for that. That is just worth its weight in gold. It's excellent. Again, the person who came up with it, the company, this company here. So all you dentists out there don't have one, really consider investing in it. It'll save you a lot of trouble. We had a CQC inspection not that long ago, we did really well, and the lady came to check me. She said, well, where's your medical emergency stuff? And I said, pulled out. I said, here we are. And she was so impressed. She actually got the details down for her own practice that she works in. because she didn't have it, and genius, absolute genius. Anyone who doesn't have this, worth the investment, because you never want to ever have to use any of this ever. But if you got it like this, you're just reassuring. Oh, the other thing is that we don't keep in there, we keep separately. Defib. I don't know now, we've had it for years, but I don't know before it was a recommendation, but I would say they should make it mandatory, because this is going to make a big difference. So I'm not going to mess around too much with this. There's a bit that flashes there, make sure that it's working. There's flashing there. Before they go to green flash, yeah? So green flash. So what you do is, here's a unit, pull it out. I'm going to start opening it because I don't want to mess it up. You got the pads here, you pull the pads off. It tells you exactly what to do. It's self-explanatory. It's got voice control commands and tells you what to do, when to clear the area. You've got to be very careful when you use a defib. Any oxygen in the area, you got to clear the area if they're going to shock, because they're going to shock. This is what's used if your heart starts to, you have to reset the heart basically when someone has a cardiac arrest. And if it's shock, it'll reset it and hopefully make it right. The chances of people surviving by doing chest compressions and this, when they're having a cardiac arrest, are massive. You want to avoid a cardiac arrest. Few things to bear in mind. Someone's got medical issues, always be aware of it. It's important. Any updates, any medication, don't make people as comfortable as they can in the waiting room. Don't have it too hot. Main thing is when people are underlying basically ill or stressed or worried about coming to the dentist and they've got underlying medical problems, it's too hot in the practice. I always say, if there's been cold a bit in the morning, especially September time, this time of the year, it gets cold and it gets warmer. So the first thing in the morning it's cold, I'll put the heat in when I go in. As soon as it gets warm enough, it's off. And if people switch it on, I say you need to get it off, because we don't want people uncomfortable and cold, but we don't want them too hot. I'd rather have them a bit cold and not too hot, because when you get too hot, you get flustered, you get stressed, underlying medical problems. Yeah, it can cause something to happen. Obviously, patients, when they have things like things they're stressed about, like fillings or maybe a tooth taken out, make sure they have something to eat before they come, because that's another thing. Because if you feel faint, it's not good. And if they feel faint and have other medical problems, it can knock them over the edge, the straw that broke the camel's back, so to speak. So you want them to feel comfortable. You don't wait too long. You want to make sure they're numbed up properly, so they're not feeling more anxious, more stressed. You know, all these things, make sure you know the medical history, make sure you update medical history. These things we always do. Any change in medication, we need to know. Any medication listed on, we need to have so we can check everything's okay. That's one of the things. Any change in medical history, are you having any problems? They're the two things you ask. Hello, how you doing? Grab yourself a seat. Any problems, pain or problems, anything you want me to look at or check. Any change in medical history that I need to know about. And then probe. If you're not sure, they tell them just probe, just find out. That's important. So that's, you've got, it tells you exactly how to put it on. One on the right above chest, one to the side. Got pictures there. And then you've got, funny, right, okay. So if they've got a hairy chest, you're gonna have to shave them, because the pads won't be able to get to where they need to. And if you've got things like a bra or something like that, you want to keep people's dignity, yeah? You know, it's very important. Don't expose people, you know. Think about if you were having a medical emergency, if you were having a cardiac arrest, how would you want to be dealt with? You deal with them properly and keep them dignified. Cover them up as much as you can if you need to, but you're trying to save someone's life. So God forbid you have to do it, but you have to cut things like if you have to cut the bra off, get it out of the way, if you have to cut clothing off, and then if they've got a hairy chest, obviously the men, then you have to shave them. I mean, I'm not sure how much that's going to do. Maybe you want to get those kind of those rechargeable electric shavers, you know, the ones for shaving the body hair. That might be better, but I'm not sure that'd be a good idea around a defib and oxygen. I'm not sure. Anyway, I should have asked the lady when we did it. Maybe I should have asked. But anyway, that's something hopefully you won't have to do. And then you've got extra stuff here, charging. You've got all the stuff here. You mean how it works. Not that you need to, because it's pretty self-explanatory stuff. User manual. It's something we get accustomed to anyway by reading. We use it. You know, we know how to use these things. You know, they're talking about the pads, talk about preparation. You know, younger children front and back, you put it on. If you can't get a good if it's person too hairy, you can't go good. You can put it either side, as long as it's in line with the heart, or front and back if you're desperate, whatever you need to do. But there's certain positions where it's ideal, so that's that. So this all goes again together because you need the scissors, proper solid scissors, those. Shaving, get in there, get that all in there. This is all checked. This is on reception, so we have it on reception. This thing. The other thing we have near the surgery, so we can get it quickly. So this on reception can need to be checked regular to make sure it's working. Someone has to always check it, so we know. And we've got different pads. We've got children's pads and adult pads with it. Yeah. And then here's, you know, just tell you what to use it, how to use it. So this is a bit of a video for people as a whole, generally, to know how we work in these practices. We take things deadly serious. Our practice, we do, and most practices take deadly seriously. They take medical emergencies really seriously. If you're taking VCS, you dentists out there, colleagues out there, people have practices, practice managers, you know, bosses, get this system. It's brilliant. It's foolproof, absolutely foolproof. It's absolutely foolproof. You can't. Yeah, it'd be very difficult to go wrong with this. It's an absolute foolproof method. And actually, when I do the medical emergency training, and we're talking about, you know, someone's feeling unwell, and they're saying, "Oh yeah, I just had something." Yeah, you've given them, like, so for example, they give an example. You just given them, they just used a mouthwash in the morning. They haven't used it before. Corsadil, chlorhexidine. Oh, I feel a bit, my throat's thingy, I'm doing this, I'm doing that. For example, or they used it in the practice for whatever reason. I quickly used it before I came in for my check. I quickly used it in the toilets, for example, and I had a reaction to it. Oh, I feel like, I'm slow breathing. I'm kind of got, I don't feel right. Face going red, throat swelling, feel like the throat is closing up, the tongue swelling up, lips maybe swelling. That's, you got an idea. You just go through this. You go through this first quickly, check, and then you go through this, and you can do what you have to administer, and it gives you everything you need to go. So even when we do it, and they explain scenarios, they explain a scenario. The lady who came to the training, and then she said, this happens. We went through this, and then she goes, well, okay, use your things. So we had these at hand. They didn't expect us to memorize it. We had these at hand so we could go through it. And then we did all the things we're gonna do. Oxygen saturation is a bit low. That means how much oxygen in the blood. Put the pulse oximeter on. Blood pressure is a bit low. Check the blood pressure. You've got all these things. Then they suddenly collapse. And each time we go through it, and then they suddenly collapse. You get an idea, oh, they've collapsed. What do you do now? You start chest compressions straight away. Really important. After checking first the breathing, checking the circulation, and nothing's happening. Cardiac arrest, chest compressions. Someone gets a defib on quick, and you follow defib advice, and you get the mask that I showed you. Put it on the mouth. Make sure head tilt, chin lift to open the airway up, because the tongue's fallen down, flapped over. Because when people lose consciousness, the tongue flaps over. Like when they're snoring, that's what happens. The tongue flaps over. And then someone's going to do the ear, and someone's going to count. Someone's going to be delegating everything. So you work as a team. So you have the nurses, you have the reception staff who train in it, you have the dentist or dentists, and everyone's going to do their job. Okay? So everyone's got the job to do. But with this, it just makes it easier. I mean, God forbid we ever have to use it, but it's good for people to see what we have in a practice to make sure you're safe in the event that something serious happens. Well, like I said, God forbid it ever happens. And this is something I would highly recommend to any dental practice, no matter how much it costs. Get it. It's worth it. It is just worth it. Like I said, the lady came to CQC inspection. That came to inspect us. She was really impressed. She really liked it. It's a solid bag. We've had this for years and years, and it's still looking good condition. It's brilliant. Absolutely brilliant. So that's the video. I thought I'd let you know. It's good for people to know what we've got at our practice, and for safeguarding yourselves if you ever need it, and for dentist, you know, I'd give this a 11 out of 10, a 10 out of 10. It is brilliant, absolutely, but you can't fault it. Absolutely amazing. The person, like I said, who's come up with it is an absolute genius. So clever, so smart, and so easy in a situation that could be really difficult and challenging if you ever get it. But like I said, God forbid, we don't ever want that to happen. So video's done. Yeah, if you've got any queries, questions, comments, just put them down, and we'll see you next time. Bit of a long one today, but worth it. Okay, take care. Bye-bye.